Hi, everyone, and welcome to week 12. This week, we're going to be talking about mental health. So the objectives this week are to define mental illness, describe the different categories of mental illness, identify how mental illness impacts women differently, and the relationship between mental and physical health. The items that are due this week are the What is Good Mental Health blog, mental health case study, your Chapter 12 quiz, and of course your discussion board. This is what your good mental health blog looks like, and the purpose is to consider your own definition of mental health and think about ways to improve mental health. And so for this, you don't need to use any readings or internet resources. I really want you to consider your own opinions regarding mental health. And the questions that you are going to be addressing are, how would you define good mental health? What does good mental health look like? How would you encourage good mental health? And then what are some ways to improve one's mental health? The second assignment is a mental health case study. And for this assignment, you are going to be reading a case study and answering questions. The case study, if you're wondering, is a true story. You will also gain an understanding on how personal qualities can help a person deal with mental illness and identify ways to cope with mental illness. So to complete this assignment, again, you'll read the case study and then answer the questions that are provided on the worksheet. I just want to take you out of here really quick and show you where that case study is located. And so the assignment is over here under mental illness case study. This is the actual assignment, mental health illness case study. And then the case studies, I have two versions here. I have one as a PDF and one as a document. So either of those will bring you to the case study. All right, moving on. So what is good mental health? One definition says it's how we think, feel, and act as we cope with life. Another definition says it's a state of well-being that allows someone to be productive, have fulfilling relationships, cope with difficult circumstances, and adapt to change. Mental health and physical health are closely connected. Mental health has the ability to affect your physical health. So when we look at people who are suffering from depression, they have an increased risk for heart disease. And this relationship goes the other way as well. So physical health also affects mental health. So lack of air can cause a panic attack. Regular exercise lowers the risk for and symptoms of depression. Mental illness is common, but it doesn't mean a person is crazy. Statistics show that about 1 in 5 adults suffer from a diagnosable mental illness in a given year. Half of all Americans will experience some form of mental illness during their lives. Most of them will benefit from treatment but can still function and live regular lives. And people with mental illnesses love others. They hold jobs and contribute to society. So what impacts mental illness? One of them is our biology. So some mental illnesses have genetic components. In addition, neurotransmitters, hormones, physical health, and other factors can affect mental illnesses and how they are perceived. Social and psychosocial factors. So it is believed that the way women are treated affects their mental health. Chronic stress and the way people react to it affects mental health and physical health. Women are more likely than men to internalize stress, which does impact our physical and mental health. Traumatic events can also cause or contribute to mental illness. And coping with stress in a positive manner can improve your mental health. So I'd like you to take a minute and think about, how do you respond to stress? What are some ways that you effectively deal with stress in your life? What are some ways that you don't effectively deal with stress in your life? And think about ways that you can improve your own ability and habits on how to manage and deal with stress. Some helpful ways to cope and deal with stress include regular exercise, doing something creative, whether it's drawing, painting, sculpting, sculpting, dancing, something that invokes your creative sense. Meditation or visualization, and having supportive social activities. So the costs of mental illness to society include, one is an undefined burden, which means it's difficult to define. Right there, so there's an economic cost to society when people are suffering from mental illness, social burdens for families, communities, and countries. And then there are these hidden burdens. There are some stigmas attached with mental illness, and sometimes there are violations of human rights and freedoms associated with mental problems. For example, should a person be forced to take medication if they're suffering from mental illness? What if they choose not to? Isn't it their choice not to treat their disease? The mental illnesses, some of them impact women at far greater percentages than men. So compared to men, women are twice as likely to suffer from depression, 4 times as likely to suffer from seasonal affective disorder, 9 times more likely to suffer from anorexia and bulimia, and about 2 times or almost 2 times more likely to suffer from phobias and panic disorders. And they are also more common in women with borderline histrionic personality disorder. However, women are less likely to have schizophrenia, antisocial personality disorder, attention deficit disorder, or be violent as a result of mental illness. There are some economic burdens of mental illness. So the need for mental health and social services. Sometimes there can be a loss of employment and or reduced productivity at the employment. Financial burden on families and caregivers. Increased levels of crime and threat to public safety. And then negative effects of premature mortality. So if someone ends up dying earlier, the impact of loss of life. So we have this legal dimension, this mental illness crime paradox. So given treatment, people with mental illnesses are no more likely to commit crimes than the general public. However, without treatment, the mentally ill are more likely to commit crimes and be arrested. So the paradox is, can we force someone to take medication because it does obviously benefit society more, or do people have the freedom to make their own choice in terms of their treatment options? If we look at clinical dimensions of mental health, we'll talk about some of the different mental health disorders and the categories. So one is mood disorders. This includes depression, dysthymia, and seasonal affective disorder. These all involve some persistent and inescapable feelings of sadness, apathy, or a combination of both. Bipolar disorder involves mood swings from manic, so being hyper and energetic and happy, to depressive phases. And then, of course, there are phases in between those as well. So think of it more as a spectrum, not as binary. As I mentioned, depression is persistent and inescapable feelings of sadness and low energy and apathy. And the treatment for depression include antidepressant drugs, psychotherapy, and a combination of therapy and drugs. And you can see here on the table some of the symptoms of depression. Again, those include persistent sad mood, constant feelings of sadness, excessive crying, low energy, feelings of worthlessness or helplessness, difficulty concentrating or making decisions, loss of interest in pleasurable activities, sleep disturbances, appetite and weight changes, thoughts of death or suicide, and then other physical symptoms that don't respond to treatment. Bipolar disorder has both highs and lows. So the highs include feelings of wonder and euphoria, being overstimulated, easily distracted, and easily irritated. Whereas on the other side, the lows are deep, persistent feelings of sadness, anxiety, hopelessness or guilt, possibly low energy, reduced sense of pleasure, lower sex drive, and thoughts of suicide. Anxiety disorders include generalized anxiety disorder, phobias, panic disorder, obsessive compulsive disorder, and post-traumatic stress disorder. Treatment for anxiety disorders include cognitive behavioral therapy, anti-anxiety medications, antidepressants, and then a combination of medication and therapy together. And some symptoms of anxiety disorders include feelings of terror and dread, feelings of apprehension and uncertainty, nervousness, irritability, rapid heartbeat, chest pain, fainting, difficulty breathing, sweating, and the belief that the signs are of a heart attack. If we look at treating mood disorders and anxiety disorders, treatment can and usually does help. However, it is difficult and it takes time. And so it's not like here's a pill and you'll feel better tomorrow. It's more here's a pill and in 4 months you'll start feeling better. That's a long time from the time that you start a treatment to the time that you start feeling better. And again, the treatment options are medication, psychotherapy, or a combination of both. And both normally work better together than having either medications or either psychotherapy. Our next category is personality disorders, and this includes antisocial behavior, avoidant behavior, borderline personality, dependent, histrionic, narcissistic, obsessive compulsive, paranoid, passive aggressive, schizoid, and a schizotypal. So schizophrenia is psychosis. It's a severe mental disorder characterized by contact with reality and having severe personality changes. So schizophrenia is a type of psychosis, and it afflicts about 2.5 million Americans. Both men and women are affected equally, but schizophrenia is more common in men. The symptoms include hallucinations, delusions, disordered thinking, impaired ability to interact with others. And the treatment, of course, are antipsychotic medications and psychotherapy. Dissociative disorders it arises from an unconscious way to protect yourself from emotional traumas by detaching yourself from part of your personality. And there are several types of dissociative disorders. There's dissociative identity disorder, which is also the multiple personality disorder. There's dissociative amnesia, where you forget part of your past, and usually it's the part of the past that's connected with the traumatic events. We look at suicide. Some of the risk factors for suicide include adverse life events combined with depression, having depression and having something horrible happen on top of being depressed, having prior suicide attempts, having a family history of mental disorders or substance abuse, having a family history of suicide, having family violence, including physical or sexual abuse, having firearms in the home, and incarceration or being in jail. If you know someone that has suicidal thoughts, get help. Suicidal urges, while very powerful, are only temporary, and so they do get better. But for people who are in the midst of being suicidal, you cannot see the positive. You can't see past the suicidal thoughts and or depression, which causes a pain, an emotional, deep pain. The person feels that suicide is the only way to end that pain. And so if you know someone who is suffering from major depression and has given some insight that perhaps they're thinking or considering suicide, get them help. So here I have the Suicide Prevention Lifeline. However, if it's an immediate problem, call 911. Save them from themselves, because as I said, the thoughts of suicide are temporary, but when you're in the midst of it, you cannot see behind it. If you have some form of mental illness, you are obviously not alone. As I mentioned earlier, at any current point, 1 in 5 Americans are suffering from mental illness. And at some point in their lifetime, 50% of all Americans have experienced a mental illness. So help is available. Help makes a difference. Treatment is effective. And so I just want you to know that if you're suffering from a mental illness, you are certainly not alone. And there's help and treatment available. This concludes our PowerPoint for week 12. Have a wonderful week, and as always, let me know if you have any questions or concerns.